The following portion of Great Day KC is sponsored by ScoliosisKC.
It's a non-surgical approach for scoliosis. Our next guest's treatment program aims to slow or stop the progression of it in both kids and adults. Let's welcome in Dr. Nick Weddle, the owner and clinician at ScoliosisKC. Dr. Weddle is an intensive certified CLEAR Scoliosis Institute doctor. Good morning.
Hi.
I'm happy to have you in and chat more because there's a lot I don't know about scoliosis. So for people who don't know, tell us the basics. What is it and how do people know if they have it?
So scoliosis, it's more involved than this, but the main sign that people are going to see is the curve in the spine. So the spine from the back should be straight up and down, and so scoliosis will cause the spine to curve sideways. And this can lead to rotation of the ribs, which again, that's kind of what is most obvious that people will see. This can cause the shoulders to be uneven, the hips to be uneven, and especially since scoliosis affects women about 8 times more than men due to the hormonal factors, this can often be a bigger issue.
Yeah, for sure. Now, how do we treat it then?
So in America, kind of the standard for kids and teens is really, it begins with the watch and wait approach. So most are just watching to see if these curves will progress to get bigger to where then they'll be a candidate for either the hard bracing approach or surgical fusion, where they're fusing metal rods all the way through the spine. And so an important note with regard to the traditional bracing is that it's not, the aim is not really to reduce the curves as much as it is to try to stop the progression of it just getting bigger.
Yeah.
So that's kind of an issue.
Is it something you're born with?
No, this is a neurological and a hormonal condition where in the kids and teens, it's mostly between the ages of around like 9 to 12, 13, where it just begins.
Okay. Okay, that makes a lot of sense. Now, what's unique about your approach and how you're treating it?
So instead of the just watching and waiting, that's such a passive approach, we immediately get started with a proactive approach. We have the most comprehensive non-surgical scoliosis treatment program in about 400 miles of Kansas City. We get started immediately with an active program.
Yeah.
So whereas like even when patients get prescribed physical therapy, for example, it's not scoliosis specific.
Yeah.
So it's the same PT that you would get or I would get.
Yeah.
So it's not going to make a specific effect to a person's scoliosis condition. So we get started immediately with an active program. It's custom designed for each patient. And then this is protocols that come from the CLEAR Scoliosis Institute.
Yeah.
There are about 8 specific therapies that we engage in.
Okay.
The main one that is kind of the most exciting part is what we call the scoliosis spinal weighting.
Okay.
So this is a custom designed, what we call a scoliosis cantilever that hangs on the person's body. So it's an exercise that you and I can't do consciously. It's more of a reactive kind of a postural exercise.
Okay.
So the patients will wear this. And we design these custom to their body in a way that when they wear it, and literally all they're doing is standing and balancing and just watching TV, it's reducing curves and changing that curve without them having to think about it.
Wow.
And so that's the main program. And we get some significant results on X-ray even within 1 or 2 weeks of starting the program.
That is so impressive. And now, I know I said before, kids and adults. So how is the treatment varying based on if you're treating a child or an adult?
Just mild differences mostly on the preference. So again, we've got patients as young as 6 years old and as old as into the 80s. So it really just depends on what their body can do. When we get into some of the more progressive cases, and this is more difficult, where we'll do the active rehab program and we'll include a scoliosis hard brace. So we use a product called the ScoliBrace, which is a custom designed 3-dimensional hypercorrective brace. And again, the combination of that and the active rehab program, research shows gives these patients the best ability to avoid the inevitable of surgical fusion, and it gives them the best quality of life. And then we have an additional product called the Scoliosis Activity Suit. And this is kind of it's not a brace, but it looks kind of like a neoprene-like wrap that the patient will wear. It's also custom designed to their body, but it's designed for them to wear when they walk. So with locomotion, as the body, as our upper body twists against our hips, it causes a muscle reaction that again is an unconscious response that you and I can't do consciously.
Okay.
And so while this has the ability to reduce curves a little bit, we focus more on the pain reduction, on improving posture, increasing just mobility and overall kind of quality of life.
Okay, so if someone is watching this at home and they have a child that they think has scoliosis or they have scoliosis themselves, what should be their first steps?
Definitely don't watch and wait.
Don't watch and wait, yeah.
Too often we're just waiting to see if it gets worse. And in most of these cases, especially for teenagers, these cases are almost always progressing and getting worse. Get an updated x-ray.
Yeah.
You can't know what you're dealing with unless you have good data. I see all the time families that are trying to make decisions based off of an x-ray from 6 months ago or a year ago. And so we can't do that. You can't make an educated decision off of outdated data.
Yeah.
So we have to get an updated x-ray so we know exactly what we're dealing with. And then I would say just research. Look and see what's really available, because most people don't know that there's an option like this.
Yeah. Thank you so much for coming in. You're the expert, and I've already learned so much, which is incredible. So thank you for being here.
You're welcome. Thank you.
All right, y'all. ScoliosisKC offers free consultations for patients and free screenings for those concerns about possibly having it. They're located in Belton, and for more information, you can call the number or visit the website that's listed right there on your screen.